Hello, everybody. It's been a little while since we've done a live Q&A, and I thought it was just an opportune moment to come together to explain what's going on with COVID-19 and flu. So when we first put this request out, this invitation out for this evening, we were only thinking that we were going to talk about flu and that COVID was going to be a vaccination offered in October. Indeed, for those who know in the press about what's been going on, indeed the vaccination programme has been brought forward hugely and starts now today, and we were informed of that last Monday. So you can imagine it's been a little bit chaotic at our end, trying to organise what we were going to do when we had a pretty good flu plan, I thought, for this winter coming in, and then what we might do for COVID with a new vaccine that was due out in October. But indeed, they brought that forward and they are looking to vaccinate as many people as possible from today through until the 31st of October. And it will be predominantly with the vaccine Pfizer, which is what you've had previously before. So if we go through that in a little bit more detail, and to reassure you, we will have clinics coming live very soon, okay? And although there is now COVID vaccine being available, it is only being administered to patients in care homes currently. So if you hear of anybody that has had a COVID vaccine, that would be quite unusual. I can't say it wouldn't happen, but it's not programmed for this week because it is being allocated to people in care homes and those people who are housebound. Now, for those people who are housebound on this call, it's just to let you know that we have subcontracted that service out to the community team, who are the ones that vaccinated you last time. So you have maybe different people, but it'll be the same service coming to your home. Now, they won't be able to give you flu at the same time because indeed our flu doesn't come until the 20th of September. So they will only be coming to you for COVID, and Jackie, our nurse, will come and see you with flu once it starts coming into the system. And as much as we hope it'll be here on the 20th, I can't guarantee that. So we've got our clinics planned for the week after, but Jackie will start looking to come out to see you from the 21st of September onwards if we've got flu and you're housebound. So keep kind of that in mind. We haven't forgotten you. You're part of what we offer and our cohort of making sure that you're receiving your vaccine. But you won't be necessarily coming to the practice. You may, however, get an invitation from us. Okay, but please don't worry about that. Okay, you're known to us, and the community team will be in touch with you shortly. Okay, to be able to do that. So moving on to what our clinics are going to look like, I always give you a little bit of statistics, a little bit of information to understand the landscape. So this year we have 2,823 people who require the flu and COVID vaccine. The same people that were offered it last winter are being offered it again this autumn, isn't it? Last autumn, this autumn, same group. So if you were offered it last year, you're going to be offered it again this year to be able to do that. So just think about that and be reassured by that process. Now you've got the 2,823 people that are on their way to be able to do that, and there are a few children under 17 that are also eligible for the COVID-19 who are at risk, sadly, as well. But we also have children aged 2 and 3 who will just be getting the flu vaccine. So we've got to kind of combine everything together so that we can offer all of you at this practice COVID vaccine and flu vaccine, and also those children that are 2 and 3 just with the flu vaccine to come out. So I'm just going to go through what our clinics will look like and so that you can see what's happening and what the invitation is going to be. So you will be invited for a flu jab, and then when you're here, you're going to be offered the COVID-19 vaccine. Okay, you'll not get 2 invites, you're only going to get 1. We are limited by the number of characters in text messages to be able to say what the appointment's for. So please just think Flu also means I can be offered my COVID-19. So please don't go and get your COVID-19 from a local pharmacy and then just come in for flu, because the government are trying to do co-administration where you get both of them with us. And that's how we're going to make sure that you're vaccinated fully at the same time. Our first clinic is going to be on the 27th of September. Okay, it will be in the afternoon and it will be in Uphaven. To be able to do that. On the Thursday, the 28th, we're going to move it to Durrington to be able to do that. And again, that's flu and COVID. And each week, we're going to be offering Wednesdays at Uphaven and Thursdays at Durrington to give you the flexibility in the afternoons to become vaccinated. Okay. We're also, though, going to offer Saturday, the 30th of September, so that you're going to be able to come in and get vaccinated in Durrington that day. So those clinics will be available to you, and also as a kind of full-on kind of mop-up, so to speak, of everybody that hasn't been able to get anywhere else, will be on Friday the 13th of October, Durrington in the morning, Uphaven in the afternoon. So hopefully you can see we've got quite a lot of kind of capacity being offered to you for a variety of different days of the week and different times at different surgeries to be able to get vaccinated with us for flu and COVID. Okay, so that's really important to be able to do that. And we'll have individual clinics for children alongside that programme as well in the weekdays to be able to do that. So hopefully that gives you the breadth of cover to be vaccinated between the 27th of September and the 13th of October. Okay, to be able to do that. And like I said, when the text message comes out to you, and I'm going to go through that in detail in a minute, the invitation, okay, you may find it only says flu because it's determined on the number of characters in the text. We will administer both or offer you both flu and COVID, okay, at the same time. There is no concern about the safety of that. That has been happening all last winter as well. So please do not worry. Okay, that's absolutely accessible and makes it very convenient for you to be able to do that. So that's what's going to be happening with our campaign. Now, we are looking at sending out invitations to you this week, all right? So you can get booked up and know when your appointment's happening, because next Tuesday or Wednesday, the government are going to be sending you messages as well to book your flu vaccine. Now, we always know, and your COVID-19 vaccine, should I say, we always know that causes a bit of chaos, because you're like, who am I supposed to book with? What am I supposed to be doing? All right. So we've just recently found that out, and therefore we're going to send the invitations to you this week so you can action that and get your appointment booked in, and then you can press delete to anything the government might send you. Okay, to be able to do that, to look at. Now, Linda's already said that she's out of the country until the 18th of October. We will be doing a few drop-in clinics around that time. It's just we're doing a condensed period to try and vaccinate our population in that kind of 3.5 weeks or so to try and get everybody vaccinated, because again, that is what NHS England has asked us to do, to make sure that we try and vaccinate people as quickly as we can. Okay, so there will be other clinics available, but they might be sporadic, they might be here and there and dotted about, depending on the uptake of what everybody wants. But fingers crossed, we'll have that sorted for you, okay, to be able to do that, and we'll match the numbers. If you don't want flu, please can you write in and tell us? The reason being, we'll stop inviting you, but we've got to actually code the decline on your records if you don't want it. So just send us a message in and we can by all means stop the continuation of our invitations. But the government don't receive that, they will continue to send messages to you. And please, I know some people have got really frustrated with that and been very unhappy with me about sending them, but they haven't come from us. They have come from the government and their kind of determination to get everybody vaccinated. To be able to do that, even though we code your records to say you don't want it, they don't look at that. So that's what's kind of happening about COVID and flu. And what I just want to show you, and I'm going to share my screen, let me just do this, is the change in what you're going to see when you receive message, and I've only got it on Word, so it's a bit clunky. It's not the finest presentation you can imagine, but it will do the job to be able to do this. So let me just share my screen now so you can see. Right, so you should be able to see this. Let's make it a bit bigger to be able to do that. So oh, Helen, the producer's just telling me to wait a minute while you should be able to see it. Oh yeah, okay, so now you can see what's happening. So this is the information from our IT system. So bear in mind, it's not very friendly to all of us, but I'm going to talk you through it. So you're going to receive a text message that looks just like this, as you can see in this top box with the yellow circle. So you are invited to book a routine blood test. It won't say that. It will say you are invited to book a flu vaccine, and it may or may not say COVID as well, purely because of the text numbers. And it's going to give you a link to click on. And that link, if you click on it, is valid for 7 days and will take you to another screen that is encrypted, it's secure to book your vaccine. Okay, so because it's got that, it will ask you to confirm your date of birth. The system is clever enough to know that it's going to you, okay, and it's going to ask for you to confirm your date of birth, okay, to be able to do that, and then you will get a list of all the appointments that are available, all right, and the time slots that are there. Okay, we'll get that updated on our system at our end, and we'll be able to see that you've booked it. Okay, and we've set our reports going from there that will only send reminders to people who haven't booked, although there will be a 24-hour delay. So if it just happens that you've only just booked an appointment and then we send out a reminder, please just think, if I booked it in the last 24 hours, it just means that our IT systems haven't updated in that period. So just to recap on that, we'll have the first bit where you'll get a text message like this. You click on the link. It's valid for 7 days, so please do it before Saturday if you possibly can. Get that in. You'll get another pop-up come through when you follow that link about putting your date of birth in, and then you'll get given the options and you can click on whichever appointment you want, okay, to be able to do that. Now, I know kind of a couple of years ago when we used this system and it was relatively new, you weren't receiving reminders about your appointments. So because it's now in the appointment slot and they've improved that, they've told us that you should receive confirmation. But what we will do is message you the day before the clinic, just saying appointment reminder, it's tomorrow, and you've just got that in the forefront of your phones. So hopefully that's beneficial to you as well. We're just putting that fail-safe in just because we've learned from previous about that. So that is kind of where we stand with COVID and flu in this current period of time. I know we've had a couple of questions to be able to do that. So I'm just going to pause for a little bit while you ever think about questions that you may or indeed may not have thought about before, but now I'm just sparking an idea, okay, to be able to do that. And while we're doing that, I'm just going to talk shingles. The reason being is that there's an updated vaccination programme from the 1st of October, but we're not putting shingles into the mix of flu and COVID vaccinations. We think that that's too much to be able to do that. However, if you're aged over 65, please be prepared for additional invitations about shingles and the new vaccination programme for that. All right, so I'm just giving you some heads up. This is on its way, but it's not being in our focus currently because we are focusing on flu and COVID to be able to do that. So I'm going to stop sharing my screen, and then we can ask any questions at all to be able to do that. Now, it's lovely. We've got 72 of you today, which is great. And I'm very appreciative of that. And we will obviously share this presentation out to everybody so that they can find out what is going on to be able to, you know, spread the word and get as many people vaccinated as we can. Now, nobody's asked any questions. So the other thing that we've added in is that and this is probably only really relevant for people that have got diabetes, or those people who have a relative, significant other that has diabetes, because there's quite a lot of change about GLP-1s. And so I brought Kathy into this presentation to kind of bring in the opportunistic moment of being able for her to ask any questions, just give an outline about diabetes and a certain medication that is now going out of stock and what that means for all of you. But before going to Kathy, it's just we are basically going to look at running a monthly live Q&A all about long-term conditions and different conditions that affect you all, and have any question being able to ask at any point in time about conditions. So what we will do is have other people talking in October. We're going to ask our new nurse, Lizzie Robinson, who some of you wouldn't have met yet unless she saw her first patients this morning, having joined us, but she'll do a talk about menopause and women's health in the next live Q&A in October. So we're going to do different themes, maybe asthma one time, obesity, cancer, all different things going alongside, but at any point you can ask any kind of question to us of any position for that about your conditions, and we will try and improve our services and give feedback about what we learn from all of you. Now, before I hand over to Kathy, there's a couple of questions in here. So somebody said, currently have COVID, when can I reschedule an appointment for COVID and flu? We understand it's still ideally 4 weeks to wait for your flu vaccine, your COVID vaccine, but if you are all well and healthy, there is negotiation in terms of with the clinical lead that they can use their own discretion for 3 weeks. But yeah, at the moment we understand it to be 4, ideally, can be reduced to 3 weeks to be able to do that. And Susan, I hope you feel better soon. The latest variant of COVID, I understand a lot of people are struggling with that variant. It's quite hard hitting. To be able to do that. Somebody else has said, are you including pregnant patients in your invites? Yes, pregnancy is a risk factor for both flu and COVID and protecting the unborn child. So yes, you will be invited. You are in what we would call the at-risk group. Mal says, is there a rollout by age and health conditions? No, it is. We have been by the government that, or NHS England, should I say, that we start currently with people who are living in care homes and those who are housebound. They're the most vulnerable. And after that, we are to, everybody can be booked within that. And really, they're asking if we can vaccinate everybody by the 31st of October. That would be brilliant across England. That would be amazing. So yeah, we've got that all sorted. So somebody said, sorry, I missed the first 5 minutes. Could you recap key vaccination dates, steps, please? So I don't know which bit you've seen. So I was just explaining that we are going to co-administer flu and COVID for you all. So whereas we were looking at just doing flu, the announcements made last week by NHS England bringing forward the COVID programme that we weren't expecting until October, maybe even mid-October, has now been brought forward to starting today. So we've had to revamp what our plans were and what we were doing, and we have from the 27th of September, Wednesdays and Thursday afternoons, and Uphaven on a Wednesday, Durrington on a Thursday, and then we'll have Saturday the 30th of September in Durrington in the morning. We'll continue the Wednesday, Thursdays through until the 13th of October. That's a Friday, and we'll have a morning clinic in Durrington and an afternoon in Uphaven, because of course we do have to keep normal services open as well. So that'll be what we are offering. I did explain that the government are sending out invitations, reminders, information next week about COVID-19 and flu. This is why we're bringing forward our invitations to this week, so that you're not bombarded with everything thinking, who have I booked with and what am I doing? When you get our invitations, please action this week if possible. It's not because we need that, it's to try and stop you being worried and booking with another place and then not turning up to that, and you turn up to us and we haven't allocated the vaccine, etc. So to just try and kind of ease the effort from you guys about what you need to do and when. All right, so hopefully that's cleared that up. Again, this whole presentation will be released on YouTube for everybody so that you can recap on it and see what we've talked about. To be able to do that, we'll also put it on our website and we'll put it on our Facebook pages later on in the week as well. So at that point, I'm going to hand over to Kathy to talk about diabetes and GLP, and already somebody said what is GLP, but Kathy will make that all clear when she talks about it, but it is a focus on diabetes. However, if you have any questions about any conditions that you are looking for a general response to, then please do ask, because although Kathy may not know the answer, what she can do is take that forward with the rest of the team and be able to understand whether or not we need to do another session on that or feed out information about what's going on in that particular area. So at this point, I'm going to hand over to Kathy. Lovely to see you all again. And yeah, welcome, Kathy.
Thank you. Hello, everybody. So if you haven't met me already, my name's Kathy. As Anna said, I look after mainly the diabetes, but do look after a lot of other long-term conditions. The reason why I wanted just 5 minutes today is there's a lot of worry and anxiety about what's called a GLP-1 receptor agonist. So the question says, what is GLP? Basically, this is a medication that we've started using recently in diabetes because it works very, very well in various ways. What GLP-1 does is it's called a satiety hormone. And what that means is it tells you when you're full. That means that it helps you reduce your calorie intake by telling you when you've actually had enough to eat. And what they've found in the research is quite a lot of people with type 2 diabetes or with weight issues have a shortage of this GLP-1 receptor. And so what this does is it prompts the receptors to see the GLP-1 and tell you when you're full. It does other things for people with diabetes as well and helps insulin production when it's needed after you've eaten, slows down glucose production by the liver overnight, so it helps you wake up with a better blood sugar, and it slows down the transit of food in the gut. So not only will it help you eat less, but it makes you feel full for longer. And the problem is that we've got a national and international shortage of these medications. What I'll do before I explain what we're doing about it is just give you some of the names in case they ring any bells for those of you that are on them. So there's an oral version that was brought out most recently, and that was because of a shortage of the injections, and that's called Ribelsus. The drug that's in it is called semaglutide. These are all quite a mouthful, so don't worry too much. Then there are various injectable versions. There's Trulicity, which is a weekly version, which a lot of my patients that I've talked to have started on because it was able to be given weekly and helped so well with the diabetes. Then there's exenatide, which is called Bydureon. There's also, which is weekly, there's also a twice daily one called Byetta, which is another exenatide. And there's one called Victoza or Saxenda, which is given daily, which is liraglutide. Now, all of these are going to eventually be unavailable due to the demand. Part of the demand has been driven by the excellent weight loss that people have seen. So people without diabetes, mostly in areas where healthcare is private, but have purchased these medications for weight loss, and they've worked beautifully. Clinics that help people with weight loss have used it. And then people like me who've seen such wonderful results with the diabetes have used a lot of it. So we've all outstripped the supply, basically. They are working very, very hard at producing more. But in the meantime, we need to find ways of helping you look after your blood sugars and keep your diabetes well controlled. And there are various ways of doing this, and they will all be personal. But those of you that are on insulin, you'll find you'll need to change your insulin regime. And I may already have spoken to you about it, but if you need to talk to me about it, obviously, we're going to work through everybody eventually. There's about 76 of you all together on these medications. Those of you on oral medication, there are different oral medications we can try or different doses of the ones that you're on. And also there are ways you can help yourself by being very, very careful with your diet, regular exercise, and helping with the weight, which we often talk about in diabetes, causes something called insulin resistance. So it means your blood sugars are higher. Basically, what we're doing in the practice is we're going to look initially at people with quite high, what's called an HbA1c. Now, this is a 12-week average of your blood sugars. And if it's already very high, it might be that the GLP-1 wasn't the best thing for you anyway. And we need to take action to get your blood sugars better controlled. And you'll find that I'll be inviting you in for appointments when you've had your blood tests done and I've seen the results. So those are people with a high HbA1c. Then there's like a middle section where the control's really quite good on the GLP-1, not perfect, but really quite good. You'd be next in line to be targeted for a chat to see what we can do to make sure everything stays nice and stable. People with exceptionally good control, I'll be sending you a care plan explaining that the GLP-1 will be going out of stock for you to maintain your current treatment regime, and we will be checking in 3 months to see if you need further intervention. We have quite a comprehensive way of keeping a check on people with diabetes. And I think anyone who's going through a change with a GLP-1 will find that I'll be doing a 3-month recall, which isn't a full check. It's just a non-fasting blood test to see what your control is like with any changes that we've made or to see if we need to make any changes. So that was the main thing about the GLP-1s, I think, just that people know that they're going to be disappearing off the supply chain. I can't see any questions in the box at the moment, Anna. I know it's complicated, and those of you without diabetes might think, well, what on earth is all that about? But it's very important for people that are on these treatments to understand that we are going to look after you. We will find alternatives. We will help you control your diabetes. Was there anything else you think I should add? And I can't see any questions in the box, so I've either bamboozled everybody or... Oh, Anna.
So can I just ask, so what are we actually doing? So if somebody's worried about their GLP, what do you advise them to do?
So what's happening is if there isn't any in stock, then they won't be able to order it. So there'll be people out there that are desperately trying hard to order their medication. Then they're getting in touch with the surgery and they're leaving messages saying they can't order their medication. What's happening then is I'm tending to make sure they get invited for a blood test to see where their diabetes is at, or a chat to see about alternatives, depending on what their control was like at their last check. If they're due their full review or it's nearly time for their full review, I'll be bringing it forward so that we can have a proper review of what's available and what's the best treatment to go forward. But as I said, initially, we're going to start looking at people with poor control who even on the GLP-1 weren't very well controlled as a target group.
Right. I understand that. But what I'm asking is that if you're there and you've ordered your medication, and you order repeat, now, if you might get that from the pharmacy, you might get that from the dispensary at Avon Valley, depending on whether you're a dispensing or non-dispensing patient. So you're explaining that once they get notified that that either the pharmacy or the dispensary can't get any more of the GLPs because it's been restricted to be able to do that, you're asking patients to contact us to request further information accordingly or review. I'm really sorry, I'm a little bit confused myself. And if I'm confused, I'm concerned that patients are confused, Kathy. So what is it we're actually...
So Dr. Green and I've looked through the list of all the patients, and there's a group starting off at the top of about 15 with poor control that we're going to be approaching.
I know, but right now, I understand that, but right now, if a patient goes to get their medication and can't get it, because the pharmacy or the dispensary say they can't get them, what are we asking patients to do about that? Now, if they're dispensing, I would hope that
I'm getting messages through.
We don't ask the patient to contact. We don't ask one of you, do we, everybody? What we say is actually it's within house, and therefore, notification request is directly asked by one of the dispensers to the clinical team to give guidance to the patient about what's needed, because from what you've said, it's individual to each patient. Yeah,
we've got an algorithm that all the clinicians can see that explains what the next step would be depending where you are on the line of treatment at the moment.
So the action is very much individualized to each patient. It's a personalised response.
There
So
isn't
we
a
can't do
one
it.
fix for all. No.
Yeah, I understand that, but that's what
Yeah.
we need to be clear to everybody
Sorry.
about what that is. So it's really important, everybody, that if you are a dispensing patient, so that means you get your medication from us, as in one of your dispensers will be informing the clinical team that we cannot get that medication, and they will be looking at contacting you one way or another for a personalised kind of reaction to the fact that we can't get that medication at the moment. If you are a non-dispensing patient, so that means that you get your medicine from a pharmacy, of course, we can't offer that service to you, patients, because we don't know whether you've got it or not. So if a patient is a non-dispensing patient and gets told by their pharmacy that they can't have any, what happens then, Kathy?
Well, I seem to be getting notifications, so they've got in touch with the surgery and I'm getting on the day messages.
So are we asking patients to phone us then? Is that what you're asking patients to do?
If they're already in a problem before we've got out to the ones that are on the target groups, then they need to let it. I mean, it's going to disappear. It's going to disappear.
Okay, so what we want people to know, I'm really sorry, everybody, this is not very clear. Kathy and I haven't been able to talk about this. What we need patients to do then who are non-dispensing, I'm going to make that call to everybody right now. And that is, you need to contact us to say that you haven't been able to get your medication, okay? Ideally, if you can put that through our website, we can get that sorted and we will process and we will ensure the clinicians are aware of that and will respond personally to you. If you don't have access to our website or to your online account to send us a message that you can do through System 1 or the NHS app, then do phone us, okay, to be able to do that. Now, the only thing to be aware of when you're phoning us is that sometimes our newer receptionists aren't absolutely clear on the variety of different drugs, medication names, because they're quite varied, and it's quite difficult to remember all of those with everything else as well. So I think it's important that if you can say GLP, that makes it much easier for everybody to understand and get you to the right person quickly. And what we'll do is we'll get a message to the clinician. So rather than a phone call, we'll get a message out to them who will then respond as well accordingly. It may not be that day, but it will be within a couple of days. So if you can give us that information about when your medication is going to run out, that would be great. So to recap on that, if you are a non-dispensing patient, so that means that you go to a pharmacy for your medication, okay, and you are told that you can't get any, all right, I'm back on the screen now, and you can't get any, then it's really important to contact us, ideally through your app or through the website. We will respond to you with that personalised response because we'll need to go and get clinical input, like Kathy said about this algorithm, about what needs to happen. All right, but it's not urgent unless, of course, you say we're running out of medication today and you've ordered it 10 days ago and you've been hanging on hoping it will come in. So please tell us when you're going to run out of medicine, because we'll have to take that into account when making your personalised response. If you don't have access on the app or to the website, then please phone us, but the receptionist will take a message. They won't offer you an appointment at that first point because they'll want the clinicians to review your medical records and set a personalised plan and then detail that in full with you. So leave that a couple of days. But of course, like I just said, if it's urgent you're running out, please tell the reception team about that. So yeah, if you're non-dispensing, do that. And of course, if you're dispensing, we should spot that and we'll be proactive with you. All right. So yeah, if you can share the term GLP, as Kathy has gone on about, I have no idea even what that stands for. I can't even remember. It's very complicated. All these different names, it's different things, and it's just one of those things, unfortunately, that it is going to be non-existent. Okay, across England. That's what we've been told. By 18 months, there will not be any more of this medication available. I don't know the details. I don't know why. I don't know how, but we need to adapt to that. So we'll have to change your program. And I'm sorry to kind of, between Kathy and I, be the bearer of that bad news. Now, in the background, as Kathy mentioned, we are doing proactive work to contact people that we see at highest risk and move through to be able to contact the people. But there are a lot of patients who are on GLP. So in terms of it's just what we would call risk stratifying and contacting people kind of as quickly as we can, but equally remembering that we have a lot of people that we need to look after across the way. Okay, to be able to do that. So, Kathy, is there anything else you want to add?
Yeah, just quickly, there are lots and lots of alternatives. And alongside that, it's really important that you're doing your part with the diet and exercise, because that's key. That underlines all of the diabetes management. It's the basis. Our treatment complements that. So do remember you can play a very important role in this as well. Thank you.
Fabulous. Well, thank you very much, Kathy, for that. And so for the kind of slight and about what you actually need to do, which is very important for all of you to hear, and what you need to do with COVID and flu. Now, I can see that Gloria's come into the meeting probably a bit late, because she said she's coming late. What's happening with COVID and flu? We are already 6 minutes over our allotted time, so we'll send this presentation out to everybody for you to be able to watch and hear exactly what's what's going on, what's planned for the future. But your invitations will be going out this week. So lovely to hear from you again. We'll be going live again next month. It's menopause. That's the main topic. But again, that's for everybody and anybody. Lizzie will be presenting with me during that session, and we'll go from there. So thank you very much for joining. Thank you for your time. It's always much appreciated, and take care and have a good evening. Goodbye.